Okay, y'all. So, we are here at the doctor's office. Well, not no doctor's office. This is bright as shit.
Because you put it bright, remember?
No, I have fixed it. But I don't know how I did it. It's these lights make me look like I'm bright.
One thing that they said in office, make sure that you get the size that you need for life. Like, not what the surgeon thinks. Like, oh, it's not going to look right. Because you want to run. You want to be active. You want to be, you know, it's not just like aesthetics with you. Like, you want them to be functional.
And I
So
want
you
them
get
to
all
be
that
big
meat.
enough to be, I want them to be small enough so when I lose all my weight that it still doesn't feel heavy on me.
Because, I mean, women with D's have a hard time running and shit. Like, they're just like, ugh.
That's why I think I want to be a C.
And you can't, and that's what it said in this article. It was like, do not let them talk you out of it.
Cause well, he told me B is just entirely too small.
Yeah, I don't think
he
B,
said.
'cause that's
He said go for
full
a large C or small D.
Large C, definitely large C. Because D, you're still gonna have issues with your back. Because the whole point of this is your back. At the end of the day, it's your back. And women who have D's have back problems. Like, they get breast reductions.
Because I want to be out of D's, period.
Yeah.
I don't want to see no D's.
Yeah.
So
If I were you, I would be C. Because, like, when I go and I look at bras, C is a really good, because with the C, you can still put a sports bra on and keep and manage them and take that pressure off your back. Once you get to a D, you're still going to have back pain. You know, that's the whole point of doing it.
So we waiting for, I think the nurse is going to come in first. And then the doctor is going to come in. Okay, so we back. And I couldn't fix the brightness. But oh well. So. And I brought coffee. And my shoe broke on the way in here. So now I gotta walk out like this. I'm mad. These are my favorite ones. Sorry, I didn't realize that. I'm gonna show y'all my text message. Oh man, yeah, I'm about to turn my camera off until, because my battery is on like 1.
Happened would be nipple necrosis.
Okay.
But you know, we talked about that, and because of her anatomic size, the like we usually would try to keep the nipple attached to the breast tissue underneath and move it up. But in her case, her nipple is so far away from where it has to be that you can't do that technique.
But I have a question about that, because I have, and one of the, you remember me telling you about one of the girls, but she's like shorter than me and she had big boobs too, but you was like, you know, it all depends on whatever. But I have 2 other friends, we're about the same height, and they may be just a little, well, I wouldn't say a little, a nice size bigger than me. But they had really large breasts too. And they didn't have to get their nipple removed. And, like, that's the only thing that's, like, bothering me.
That's her biggest concern.
Is because I don't want to have to where like the nipple is moved and like I have no sensation in the nipple. That's the only thing that is bothering me, because I still want to have sensation in my nipple.
So I understand what you say, like the space in between is so much larger, but once you actually remove that tissue, won't it be a shorter space? You see what I'm saying? Like, it's not going to be obviously as big as they are right now, because you're going to be removing a lot of that space, so that space won't be.
No. So here, let me draw you a picture. You have to have. So, like on the side view, it usually looks like this to begin with. Like where the nipple is below this crease.
Right.
And we're trying to make the nipple about the same level as that crease. So you end up with a smaller breast that looks like that. So when you do this, you cut around the nipple, then you have to leave whatever tissue is attached to that attached. That's the thing that keeps it alive.
So it's like a keyhole.
On the side view, you'd have to leave tissue attached from this nipple back to the chest wall.
Oh, I see what you mean.
Like this.
Yeah, yeah. So it doesn't. So we're not. So it's not this that's determining all this tissue. It's literally just.
If when you leave this attached to this, now you can move this wherever you want. You could move it up here because it's still attached down here. But if your breast,
too long.
If your breast is like this, I'm going to exaggerate, but it's like that.
It's too long.
Then the amount of tissue that you have to leave attached here, it is so much that you can't put it here.
It would literally be all.
Well, if you put it here, it'd be way too.
Yeah.
There's
Well, why
limits
can't
on.
you cut the muscle down instead of cutting it
Well,
off?
you have to leave between here and there. You have to have that attached to keep this alive.
Yeah.
You can't. That's how much you have to leave attached.
There's no way to cut it, because if he were to cut it, you're cutting off the blood supply, and it's still going to be a free nipple.
So you're saying like maybe just leave this much of it attached. But if you cut it here, then it's not attached to anything.
So you're leaving the skin, but it's still getting.
So, but you can't like attach the muscle back to the muscle.
Like if you cut this here, then you cut off the blood vessels that go in here, and there's not a single vessel inside this that's big enough to reattach.
Like if they're too small.
If there was a single artery that went all the way here, then you can cut it and then reattach it. But that's not. There's no vessel inside there. It's just the tissue that's attached. And so if this distance is too long, you just can't do it.
I know this sounds really radical, but what if you were? What if you were to attach it, and it would, like, say you have this long skin, long muscle still, and you were to attach it and then kind of leave that there, and then later after it's healed, cut off the excess, or would that just look too weird?
You wouldn't be able to close it.
Oh.
Because it's too long.
Okay.
Well, that and the longer this gets, the less reliable it is because there's not a big artery in there. So like, you can't leave it attached. Like if it's hanging down to your waist, you can't leave that. It won't stay alive anyway.
Yeah. Okay. So that answered like 3 of my questions.
I mean, you could go get, this operation's been around for a while. So
of course.
Everything that you think of
It's already been tried.
That might possibly work has been tried probably 30 years ago. Because if there was a way to do that, I'm not saying you're not smart, but I'm just saying like the people that have dedicated their lives to doing this kind of thing,
couldn't make it.
It's unlikely that you're going to come up with something in 3 weeks that nobody in the history of the earth has thought about. So all these things have been tried.
So I'm going to lose all sensation to my nipple.
Pretty much, yeah. There have been some women after the full thickness nipple grafting, which we're planning. There's some women that swear they have feeling there.
So
but
it's
I don't know that.
So like I won't even have like it'll just be like
skin, like skin,
like I won't even feel like a.
No, like somebody.
Do you have a scar somewhere?
Like if somebody lightly brushes against it, you wouldn't feel that.
Don't get too close to fire. You won't know your nipples on fire. Okay.
That's the only thing that's bothering me. It's like.
But it's like you have to weigh, like no sensation in your nipple, back problems for the rest of your life. That may require surgery. That may require,
It's a trade-off. I mean, that's why we're talking about this thing
Now. Let's see. So that was good. Can you kind of guesstimate the gram removal based off of her size now? Like if she were, because she was discussing like that she was wanting to be like a full C.
I did in my original count today. I think it was like 1,100 grams. It's 454 grams in a pound. 2 pounds, 900 grams. So we're talking 2.5 pounds per side,
Really?
roughly.
I thought it'd be more because these things are heavy.
Well, no. Okay, so it's mostly fat and skin. There's some breast tissue in it. So if you go to the store and you buy 2.5 pounds of hamburger and make a mound out of that and put it on one on each side, that's a lot.
That's like taking a 5-pound weight and putting it around your neck and just sitting it there and walking around. Like it's a lot.
No, I mean, like go to the store and buy 2.5 pounds of hamburger and mound it up and see what it looks like. I mean, that's
So, and that one thing,
surgery on hold on line two.
what is the log of ground beef?
Yeah.
How many pounds is the baby one? Like the real small one? Is that a pound?
Yeah, that's 1 pound.
Oh.
So it's 2.5 of those on each breast.
Oh, okay.
Okay.
That's a lot.
I think you change your mind now, huh? It's like, that's not that much. Oh, wait
So
a
the
minute.
tissue that gets removed, do you send that to the lab?
Oh, yeah.
Okay.
It gets kept separate. The right and left sides are kept separate, and it all goes to the lab, and they check it out
Okay.
to make sure there's
And-
no tumor. Or...
You probably already told her this, but approximately how long are you thinking surgery will be about?
About 3.5, 4 hours.
Does she spend the night afterwards, or does she go home
Yes.
right away? Okay.
No, we spend the
Just
night.
one night. depending.
Well, we'll see how she's doing the next day.
So, how do you
getting
determine
nervous
the
now.
size of the nipple areola complex? I know that she likes to have a lot of. Black women, we tend to have a lot of areola.
So you want a lot of areola?
So she kind of.
I want it to be like, because I have a lot of areola.
Well, it's not.
I don't want to have like this baby areola.
No, what usually we do it. I'm not sure exactly where this comes from. But usually I make it about 42 millimeters.
So how big?
So
is
I will show you what 42 millimeters looks like. You can get it a little bit bigger than that if you want to, because if we're going to do a graft, you can make any size you want, really. 42 millimeters. So it's from here. That's 4.2 centimeters.
Nope.
Yeah, she's got one bigger.
Yep.
So it's roughly this big.
Yeah.
Oh yeah.
Bigger.
That's about mine. I think.
That's about 42 millimeters.
Yeah, that's-
You want it bigger than that?
That's
Like,
fine.
I want it
That's
to be probably.
You
just
want it to
a-
be this big?
Doctor, I'm a B. And look at mine.
Okay, so let me.
I'm not gonna put your boob on there.
And I'm like a 36B.
So you want it to be like that's about 6.5. So that's about like that.
Yeah, that's
That's
You want it
Yeah.
bigger.
this is that's about 6 centimeters right there.
That's how big you want it? Or you want it bigger than that? Yours is gonna be your breasts are gonna be bigger than mine.
So when you do the graft,
I just want it to look like,
Like
if
not
my
baby.
boob is if I go to like a large C, I just want it to be enough areola where I know you're gonna see scars. I completely know that, and I'm
Okay with that.
okay with that. But I want it to be enough areola to the ratio of boob. I don't want this boob and then this baby areola, because I have large areolas and that's what I'm used to seeing. I don't want to say like white women, but it's true. Their areolas are way smaller than it seems to me African American.
well, so the other issue with the graft is, so when the definition of a graft is that the tissue that you're moving doesn't have its own blood supply. It's not attached to anything. We cut it completely free. So the way it survives, it has to get enough blood flow, enough nutrition from wherever you put it to take. And the thicker that piece is, the harder it is to take. Like that's why you can't like just move your foot up to sew it on somewhere. It doesn't work.
Right.
It's too thick. So the
Very
nipple
thin.
part, the areola is thinner, but the actual part in the middle, the part that sticks out the nipple, that's thicker.
Do you cut that down?
No, we don't cut
Oh.
it down, but a lot of times that whole thing, if your nipple sticks out that much, probably not, that whole thing's probably not going to survive. It's just too thick. Like probably that much will.
When you say survive, what happens? Does it just
It just dries up and
Okay.
like you'll form a scab on the tip of it probably. And
it
then when the
falls off?
scab falls off, it won't stick out as much.
That's if you have a really long. Do you have a long nipple?
No, my nipple's like yours.
So then you probably won't. Like the longer the nipple, the more.
Well, yeah, the thicker it is, the harder it is
Yeah.
to take.
So
Yeah, I don't have like a one that's
Really?
like, but it's a nice size, but it's not.
which hospital will the procedure be performed at?
Right over here, this Mercy West Hospital, like right in back of us.
And then I know you prefer to use drains, right?
We usually do, yeah.
Okay.
Especially if it's, bigger.
Mm-hmm.
Then we put that vacuum dressing on it, when you wake up, and then that